The following portion of Living Local DMV is sponsored by Ashburn Children's Dentistry. Welcome back. Could your child's ADHD symptoms actually be a sign of poor sleep? In honor of National Sleep Awareness Month, we are exploring this often overlooked connection.
And here to guide us through how sleep-disordered breathing mimics ADHD and often leads to misdiagnosis are doctors Lynda and Krystle Dr. Welcome back. So great to have you guys here. So though we are talking about it in children, I am really leaning in because it feels like this story completely applies. But please speak a little bit more to how sleep-disordered children leads to misdiagnosis.
So there are about 6 million kids that are diagnosed with ADD, ADHD in the U.S. at this point in time. And they've always, or they're getting the medications that change their brain chemistry. So there was a huge study, research that was done by Dr. Karen Bonnet. She followed 11,000 kids for over a period of time, and she found that kids with sleep-disordered breathing were up to 100% likely to get diagnosed with ADD, ADHD by age 7, right? And a lot of the issues started in infancy. And so it's just one of those things where you have to think, like, are we medicating behavior versus looking at the root cause instead of, you know, just kind of looking at the symptoms. So that's where we come along as well.
And we have some of them up on the screen right now, and I kind of wanted to talk about this. You know, it sounds like the symptoms of ADHD and sleep-disordered breathing can be similar and can mimic each other. Can you talk a little bit about that?
Sure. So it's not always about being tired, right? A kid can show hyperactivity, things like bedwetting, poor behavior, crankiness, things like that, and just even poor school performance. And those things mimic ADD, ADHD behaviors, and they could just be exhausted because their brain's not getting enough energy and oxygen to continue.
That's what it is.
Yes.
For adults too.
I know, truly.
It's chronic.
It
keeps
chronic.
happening.
Now, how does the airwaves, airways, come into play when it comes to our children and them getting a good night's sleep?
Well, it's really important because what most people don't know is that how well you breathe and how well you sleep depends on how well your face grows. And for your face to grow well, your tongue has to function well, which when you function well, you have better spacing around the jaws, which now gives you more space to breathe. And so if that doesn't happen, then you don't get to have good growth. If you don't have good growth, it's harder to breathe through your nose, it's harder to sleep well. So because most kids will toss and turn at night, which means that they're not getting that deep restorative sleep, which is when you get the memory and you get the cleansing and you get the cognitive improvement on children when it happens. So that also will make them not be healthier during the day as well.
It's kind of a domino effect, it sounds like. If one thing's happening, then it might lead to others. So what should parents be watching out for when this might be happening?
Oh, great question. So for a lot of the parents, it starts with mouth breathing. You see their mouth is open either when they're watching TV or when they're sleeping, or you can hear snoring, even if it's just slightly, a little bit. And then, of course, we talked about them being cranky in the morning, or they wake up in the morning and the bed is like a tornado, or you see the kids sleeping in weird positions. Sometimes babies have their butt up in the air. So all of those are signs that the parents should be watching for.
Bedwetting, things like bedwetting, past the potty staying age, which is age 5. Those are also good indicators. And again, it starts off with something small like mouth breathing and snoring, not just full-blown sleep apnea.
So clenching or grinding teeth.
This all happened to me as a kid. Now hold on, it's real.
Now, say, for example, you do see those signals in your children. What should parents do?
What we recommend is that parents take a video clip of their children sleeping and then take it to their provider. hopefully it will be an airway aware provider. This is not something that most people get taught in school. You have to learn that outside of school. And then if you notice any of those things that we talked about, open mouth breathing or snoring or moving around and things like that, and then you go to a provider and they tell you they're going to grow out of it, find a different provider,
okay.
because that just means that they don't understand what your child is going through, because it stays with you through life. And just something that we haven't talked about is that open mouth breathing eventually leads to the snoring, eventually it leads to them not paying attention, not being focused, and migraines and headaches, and ultimately that's what's called obstructive sleep apnea, which is where you actually stop breathing in your sleep.
Right.
Yes, and
You
that's
want
the
them
end
to- parents
stage.
wants to- They should track the symptoms, track the nutrition, which is also really important. And then again, we're always there to help. So we're there to help with resources, guide, and we also treat. So
Yes.
yes.
Well, this is all such incredible info for parents. If people want to find out more, how can they do that?
Well, they can look us up on our website, www.kidssmile.com, follow us on Instagram at Ashburn Children's Dentistry, or the good old phone, 703-723-8440. The more important thing that we really wanted to make sure gets out there today is that you tell your provider, Dr. Krystle and Dr. Lynda said, before you put your child on the brain-altering medication, check their sleep first. Have somebody
Absolutely.
check to make sure they're breathing and sleeping well before you put them on medication.
Absolutely, and we have a flow code we're going to put up on the screen for Ashburn Children's Dentistry right now. Doctors, thank you so much for joining us today.
Thank
It's
you
our
so
pleasure.
much.
Thanks for having us.
Absolutely.
It's our pleasure.
Absolutely. The preceding portion of Living Local DMV is sponsored by Ashburn Children's Dentistry.